Bismillahirrahmanirrahim. Arachidonic acids, they are oxygenated by four pathways, in which number one is COX pathway. This arachidonic acid is oxygenated, addition of oxygen into this arachidonic acid, addition of oxygen, one oxygen, next oxygen, next oxygen, next oxygen. देखो भाई, दिस इज़ द एराकिडोनिक एसिड, इसमें ऑक्सीजन नहीं है, जबकि इसमें एक्स्ट्रा 1 2 3 4 इसको कहते हैं ऑक्सीजनेटेड प्रोडक्ट्स, इसको कहते हैं एंडो परऑक्साइड्स. द कॉक्स 2 एंड कॉक्स 1 बोथ converting arachidonic acid into prostaglandin G2, which is biologically inactive due to this hydroperoxide. Due to this hydroperoxide, this prostaglandin G2 is biologically inactive, and these COX creating one oxygen linkage at carbon 9 and one oxygen linkage at carbon number 11, and there's in between there's a single bond between this oxygen and this oxygen. So such molecules are known as epoxide. In addition to hydroperoxide and this endoperoxide, there is a bond creation between carbon number 8 and 12 in the arachidonic acid, which is known as prostaglandin G2. This prostaglandin G2, which is biologically inactive due to this hydroperoxide, is become inactive with the help of peroxidase enzyme and creating hydroxyl group at position number 15, and this hydroxyl group is essential for biological activity, and now this structure is known as prostaglandin H2. Now this prostaglandin H2 is converting into other isomeric compounds, for example, including, for example, this PgH2 is converting into PgE2 with prostaglandin E synthase enzyme, and this PgE2 is then converting, is reduced into this prostaglandin F2 alpha with the help of prostaglandin E9 keto reductase. This is position number 9. This is keto form. This is position number 9, and this is hydroxyl form. Due to this enzyme, this position number 9 is reduced into position number 9, which is hydroxyl. This keto form is reduced into hydroxyl. इस कीटो फॉर्म के साथ एडिशन ऑफ हाइड्रोजन हो जाता है, तो ये एडिशन ऑफ हाइड्रोजन टू दिस कार्बोनाइल कार्बन बिकम हाइड्रोक्सिल. Due to the enzyme prostaglandin F2 synthase, this prostaglandin H2 is also converting into prostaglandin F2 alpha. This prostaglandin F2 alpha is also created by the reductase enzyme. This prostaglandin H2, which is active, also converting into prostaglandin G2 with the help of prostaglandin G synthase enzyme. In addition to these, the prostaglandin H2 also converting into thromboxane A2 with the help of thromboxane A synthase enzyme. This is the structure of thromboxane A2. This prostaglandin H2 also converting into prostaglandin I2 with the help of prostaglandin I synthase enzyme, and then this prostaglandin I2 is converting into prostaglandin 6 keto prostaglandin F1 alpha. This at position number 6 there is a keto form. In addition to these biological conversion, this COX1 is widely distributed in the body and has housekeeping action, especially at gastric protection, gastric region. And this COX1 is 2 to 4 fold time increasing when there is a immune stimulation. This COX1 is inactivated by the acetylation of aspirin. Aspirin is acetylating this COX1 and blocking this COX1. This COX2 enzyme is an immediate early response genes production in inflammation and immune cell. अब इसकी expression जो है it is 10 to 18 time increasing when there is growth factor increasing 10 to 18 time इसकी expression increase करता है. Tumor promoter इसकी expression ज़्यादा करता है 10 to 18 time. Cytokines इसकी expression ज़्यादा करता है from 10 to 18 time. In addition to these bad effect, COX-2 also involved in normal renal development, and vascular prostacyclin are also produced normally. This prostaglandin E1 analog या derivative alprostadil, this is muscle relaxant. Prostaglandin E1 derivative mesoprostol, it is peptic ulcer protection. It protect the stomach for ulcer, and this mesoprostol in combination with this mifepristone for the treatment of early pregnancy. This prostaglandin E2 and prostaglandin F2 alpha derivative are itself are used in obstetrics, latanoprost, prostaglandin F2 alpha is used in ophthalmology. Prostacyclin, prostaglandin I2 is they are synthesizing, producing in vascular endothelium cell, and in this prostaglandin I2 is a powerful vasodilator and inhibitor of platelet aggregator. And same is the case prostaglandin thromboxane A2 cause platelet aggregation, vasoconstriction, and thromboxane A2 receptor antagonist and synthesis inhibitor are developed for the CVS indication.